Welcome to the webinar, Improve Residents' Communication Skills Before Orientation. Hello, I'm Barbara Lewis, the Managing Editor for DocCom, an online communication skills learning system for residency programs, hospitals, and medical schools. Joining me today is Dr. Surendra Maur from the Greater Baltimore Medical Center. Welcome.
Thank you.
Can you tell us a little bit about your background?
Sure. So, again, my name is Surendra Maur. I'm an internist by training. I've been doing medical education since graduation. I'm presently Associate Program Director of the Internal Medicine Residency Program here at the Greater Baltimore Medical Center. We're what I consider a medium-sized program. We have 36 total residents. And we, of course, then take in 12 interns every year. And again, we're your typical 3-year program.
Okay, thank you. This webinar will, go ahead.
No, go ahead, please.
The webinar will last about 30 minutes, and a recording and the PowerPoint will be available on the DocCom website shortly. So if you have any questions, you can type them in the chat box located in the panel. And if we don't have a chance to get to your question during the webinar, we'll respond afterwards. So can you tell us a little bit about the Greater Baltimore Medical Center?
Sure. So we're a community hospital located just north of Baltimore, about 10 miles north of Baltimore, where we take care of both suburban and urban patients. It's about almost a 200-bed medical surgical hospital. Again, we have an internal medicine residency program. We also have a GYN residency program and a colorectal fellowship program with numerous residents rotating from other disciplines from nearby University of Maryland and Johns Hopkins Hospital as well. We also have medical students from Caribbean schools who rotate through us. The majority of our medical residents are international medical graduates, and so we found a challenge in helping them improve their communication skills for our patient population.
Okay, do you want to describe a little bit further that challenge that you had in your program?
Certainly. So the challenge was basically helping our residents connect with their patients. As you can imagine, one of the key skills that enable a physician to help our patients is to basically attain their trust, and the best way to attain your patient's trust is if you can communicate with them very well and connect with them, at various levels outside of just being their physician. And so we had a challenge of a lot of our international medical graduates making that connection with patients, because typically, at least from their backgrounds, it was seen as a paternalistic relationship, whereas, as you know, it's very much a cooperative relationship with our patients here in the United States. And so we actually looked into various communication simulators, if you will, and we did discover DocCom about 5 years ago to help prepare, or I should say teach our residents on better communication skills and how to communicate with their patients.
So in particular, you said that you were looking at the EPA and noticed that the history and physical was not that great.
Exactly. So when we evaluate our residents when they first come to us, we evaluate them on 5 particular skills, because we find that those are the most important skills that they need on day 1 of working, which is July 1st for us. And one of those skills includes the history and physical, which basically means are they good at gathering data, and part of that gathering data is the history and physical history taking. And so because they weren't connecting very well with their patients, they weren't getting really good information from their patients, and hence the data was quite limited in their history taking. And so with that said, we came up with these modules to help them.
And I think that in particular you were talking about the fact that they seem to know what to ask, but not necessarily how to ask the questions. And that was where you felt that perhaps modeling it or seeing the videos would help them. Is that right?
Exactly. Because like you said, you can give them a list of most common questions to ask for a particular situation, but the challenge was you get a different answer from your patients if they don't feel like you're connecting. And so we noticed that the quality of the patient's answers weren't as good as compared to somebody who can connect with them.
Mm-hmm. Mm-hmm. Okay, so what was your solution then?
So our initial solution was, as we identified these residents who weren't taking good histories during the orientation period, which is just 1 week prior to the first day of work, we would use modules like these DocCom modules at that time to see if we could help them remediate. But the time frame, it was just too short, so we weren't getting the results that we needed. And so oftentimes these residents would improve for another arguably 2 or 3 months afterwards. So now you're into the months of August, September, October, and then you're already a quarter of the way into their internship. And so for that reason, we wanted to find a better mechanism to improve their skills as soon as possible, so they can literally hit the ground running when they come to when they start their residency.
Mm-hmm. Mm-hmm. So DocCom, of course, is online, easy access, anywhere, anytime, and this is what the results of surveys that we've done have shown, that the learners love to do this in their own time, anywhere. So you decided to assign the DocCom after the match in March, and the match just occurred on Friday, and you told me before you're happy, so that's wonderful. Congratulations with that, because I know it's very nerve-wracking. But the reasons that you thought that it would be better to assign it after the March was the time and the inclination to impress you. Is that right?
Exactly. So this way, for those who need a little bit more time to adapt, if you will, they have that time now that they start the modules from this point onwards, and we ask them to complete the assigned modules before they even arrive for orientation, which is typically mid-June. This way they have at least the foundation, because for a lot of them, the whole concept of emotional intelligence, if you will, is new to many of our new interns. And so at least this introduces the concept to them if it's new, or if they had deficiencies, at least this will help start their improvement plan.
So they need to complete it before orientation in June. And historically, when do you send out the assignment? So the match happened on Friday, and you know who you got. So now when does the assignment go out?
Right. So we actually send out the assignments the following Monday. We send them a whole welcome packet, and we give them just some what we call pre-orientation exercises to complete, with the expectation of them completing it before they arrive, and that includes these DocCom modules.
Mm-hmm.
And as you mentioned, because of how it's all web-based, people can access it from wherever they are, and I really appreciate the administrators panel that's available, where you can see which modules have been completed by which residents, and with the whole notion that there's a pre-test and post-test.
Mm-hmm. Mm-hmm. So then what you decided to do is, you knew it was anecdotal that they seemed to be better communicators when you assigned the DocCom before, right? That's what happened?
Exactly. Exactly.
But then the test, go ahead.
No. So, I mean, with the pre-test and post, we're able to identify early who could have some more communication issues even before they arrive, and so that we can get them even more help during the orientation period. Again, the whole idea is to get everyone to be at least at one level of communication before they start work on July 1st.
Mm-hmm. Mm-hmm. So what we decided, we partnered up and decided to do two tests. One would be an empathy understanding test, which is in DocCom Module 6, and the other one is selected multiple choice questions from our modules that are most closely aligned with HCAHPS, which are the patient satisfaction surveys that are mandated by the government if you receive government money, and I think probably every hospital does. So those modules are 5 through 13. And then we wrote up the directions. I did in the introduction and put everything on SurveyMonkey and a link to a website that was not related to DocCom at all. So the purpose of this was to ensure that the learners, the interns who were coming in, had no idea that these had anything to do with DocCom. So we have 42 modules, and you selected 27 of these. So how did you select these particular modules, Surendra?
Right. So, I mean, the modules we chose were best aligned with our clinical situation, basically. Being an internal medicine residency program and being that our training happens in outpatient setting and inpatient setting and the critical care setting. And being internal medicine, we take care of, basically everyone from 18 and older, and so it includes the geriatric population. And so it just basically we picked those that we already see our previous residents encounter.
Mm-hmm. Okay, so I'm going to jump in here and just talk a little bit about DocCom. So here's the assignment of the 27, and each of these are about an hour in length. So that's about 27 hours that were assigned to be completed in June. So DocCom is a proven online interactive healthcare two-phase learning system. And we were founded in 2003 by the American Academy on Communication and Healthcare and Drexel University College of Medicine when a gap was identified in communication learning for medical students. So initially, DocCom was for medical schools, but our fastest growing area right now is residency programs. We obtained a grant from the Arthur Vining Davis Foundation, and we were launched as a pilot in 2005. We debuted as a nonprofit, and we began offering continuing medical education in 2015. So what happens with some of our residency programs is they include the faculty, they include other physicians that may want to get CME as well. And we have a sliding scale, which I'll discuss at the end of the presentation, so that the more that you have, the less expensive it is. So we have about 90 institutions currently that are institutional subscribers. We have 6 journal articles that talk about the value of DocCom and that have studied DocCom and published articles. We're in 14 countries, and we are in 4 languages as well. So you probably know the evidence-based importance of communication skills, but evidence is proving that good communication skills improve medical outcomes, decrease malpractice claims, enhance the physician, the provider satisfaction. And now through surveys, through the HCAHPS, we're discovering that patient satisfaction scores increase as well. So I was just at a conference yesterday in Denver talking to a group of people that do surveys, and I was mentioning to them the fact that the HCAHPS, the 2 communication dimensions on the HCAHPS surveys are what's proving to be drivers. And he said that's what their research shows as well. So those two communication dimensions, if you get high scores on those, your overall scores are high, and if you get lower scores, your overall scores are lower. And of course, this is now tied to money from the government. So DocCom is a flipped classroom model. This is the Khan Academy model, where Surendra assigns those modules, and the interns complete them at their own time and wherever they want to. So we have leading faculty that have put together these 42 modules. And we have over 400 realistic videos that are not scripted. And in our surveys, this is what people really love about DocCom, the fact that they can see people talking, the clinician talking to the patient. And I'm going to talk just about the annotated videos in a little while. Tons of literature references and checklists too. So we're a mobile device now, so if you have to deliver bad news and you haven't delivered bad news much, you can go on your mobile, get to the checklist and say, okay, here's the 15 things I need to do. Here are the things I need to do before I walk in the room. So all the modules are consistent in format. They start with a rationale. They have the patient-clinician views. There's reflection questions, key principles, learning goals, and a reference list, which I mentioned. So here's a behavioral checklist, for example. This is an annotated video, which learners are generally very impressed with this. So the highlighted area is what they're talking about now. And if you click on the icon that is the movie icon, out pops the clinician talking about what he is trying to do at this point. So he's assessing conviction about changing behavior and what's going on in the back of his mind and what he's trying to get at. So this is very interesting. It's not just talking between the clinician and the patient, but it's also what's going on in the back of the head of the clinician. This is the empathy understanding test that was used with the interns at Greater Baltimore Medical Center. So as you're watching the video, in this case, the physician does not make any empathic comments to the patient. And so you click at the bottom here of where you think an empathic comment should have been made, and then you can score yourself. And what happens is oftentimes residents and others think that if you say an empathic comment, it's going to open a Pandora's box. There's going to be tears. There's going to be more conversation, and I'm not going to get out of the room as fast as I need to get on to my next patient. Actually, evidence proves exactly the opposite, that if you don't make an empathic comment when the patient would like to hear one or expects one, that the patient will go on and continue to talk and try to solicit that empathic comment. So this kind of cues the learner for when an empathic comment should be made. This is our facial recognition comprehension score, where you see these facial expressions for 5 seconds, 3 seconds, and then just a microsecond, and try to recognize whether it's one of these 5: anger, confusion, fear, grief. And here in our patient portraits, which we've gotten a lot of great feedback about, these are 5 real-life substance abusers, formerly, including a physician, answering 22 questions on why they started and trying to quit. And we were trying to get at here the fact that this is not just a situation where someone needs to say, you know, get off of it, stop it, why you're doing this, but really understand what's going on with these 5 real-life substance abusers. And we have a ton of resources here. So what I don't have here is the grade that you were talking about, Surendra, and this is an Excel spreadsheet, if you can imagine this, with the names of all of the learners down the left axis and all the modules across the top. And they're color-coded, so 100 gets a bright green and 15 gets a dark red, and so you can see which people have done which modules and what their grades were. And if you'd like to see that, just email me, and I'd be more than happy to send you that slide that unfortunately I left out of this presentation. Okay, so Surendra, thank you so much. And now if you can talk a little bit about the what happened at that point. So you assigned DocCom.
So yeah, we assigned DocCom, and we certainly noticed when we assessed their H&P skills by the time they came to us for orientation, there was a noticeable difference in the quality of the history and physical. We also, because it's a direct observed skill that we do during orientation, we already noticed people using empathetic language as well as body language that we had not observed other people do in the past. And so we knew that they were employing what they learned from these modules. So it was quite refreshing.
Mm-hmm. That's good. So you intuitively thought that they looked better, the second cohort, they sounded better, but now we actually proved it. So here are the scores, and in the empathy understanding test, the average score of correct answers was 41%, and that went to 96% average scores after they had studied DocCom. And the multiple choice questions, delta, ranged anywhere from 7% to 75% between the before and after. And the two lower scores are people that scored higher initially, so they didn't improve that much. But the average increase here was about 45% in the between the scores before DocCom and then after viewing DocCom. So, you know, one of the downsides here is that we don't know the communication skills improved by this, because this is just the testing of it. The test scores did improve, but through the observation that Surendra has made, he's saying that, you know, the communication skills did improve. So we are actually thinking of doing more tests, residency program researching. We would have 3 links to test the empathy and 3 survey monkeys with the multiple choice questions. One could be after the match and before DocCom use, and the second one is at orientation after DocCom use, and the third one could be after several or a couple months of working, perhaps in September. So if you have a residency program that has a good number of residents, we'd love to test this with more, and that would be a test that we would love to do with you. So here is the subscription cost, which is, I've been told, is quote dirt cheap, which is, I think I need to change that. But from 10 to 29 seats, it's only $45 per seat per year. So, and this goes down to $25 per seat if you had over 500 people who are signing up. And as I mentioned before, sometimes it's not only the residents, but it's the faculty, because the faculty want to know what the residents studied, and then it's other physicians that may be connected that want to get CME or want to improve their communication scores through HCAPS or whatever the case may be. So I'm going to offer all of you a free 30-day trial subscription. You can go to DocCom.org and click on subscriptions and trial, and this is the promotion code, webinar MAR17. And that will give you a free 30-day trial subscription so that you can tool around in DocCom. And if you have any questions or any feedback from me, I would love to hear from you. But you're welcome to try DocCom yourself, and if that's something that you would like to use with your residents to help improve their communication skills, I think that would be great. So Surendra, do you have anything else that you want to add to our webinar today?
Sure. I guess I'm just thinking about the next iteration of what we can measure. As you mentioned, what we've tested is really the residents' attitudes towards communication, teaching, and modules, and really just testing their knowledge of it. But as you had mentioned, if we can see if this translates into better patient relationships and better patient outcomes, those would be the ideal things to measure. And so we'll have to certainly come up with that next step measurement.
So that can be your own survey that you do, or it could be through HCAPS too, if you have HCAPS that are drilling down to the resident level, to the clinician level. And I know some hospitals are tracking that so that they know exactly what the HCAP scores are that each one of the clinicians gets. But also others are using their own surveys to track this as well. So thank you so much for your time, everyone. And Surendra, thank you for spending the time and talking to us. Last year we talked about the fact that you thought that it was better, and this year we actually proved it. And DocCom really appreciates your time, and thank you so much. And thank you, everyone, for attending. And you'll be able to see a recording of this or pass a recording on to someone if you want to. And the PowerPoint will be up on our website shortly, and we'll be sending you information about that. Thank you, everyone, and goodbye.